Onychomycosis is an infection of the nails occurring both on the hands and feet, but certainly found more on the feet due to the environment that feet find themselves in. This condition generally thrives in dark, moist environments. So when you consider wearing shoes and socks all day, along with perspiration that may occur, it ends up being a perfect growth media for this type of fungus. This condition was rarely seen 100 years ago, but has become more common due to the lifestyle changes that we all experience, such as communal bathing areas, greater use of occlusive footwear, and the increasing incidence of diabetes. Athletes, particularly runners, are more inclined to develop this problem. The incidence of onychomycosis increases with age, the majority being over age 55, but we also see it in teenagers as well. For most people, this is a progressive disease that if left untreated will continue to spread from toe to toe. Symptoms of onychomycosis. The true, tough to get rid of fungus actually grows underneath the nail. As it grows, it forces the nail up off the nail bed and the nail becomes thick, crumbly, and discolored, ranging in color from yellow to brown. There may also be an odor. It is not uncommon for these infected nails spread to the other healthy nails. It is also not uncommon for these types of nails to fall off, but unfortunately, in most cases they grow back with nail fungus if not properly treated. So, what is wrong with having nail fungus? 1. It's cosmetically unappealing. Most people are embarrassed by the nail appearance. 2. Nail fungus makes you more susceptible to developing athlete's foot. 3. It increases the chance of developing secondary bacterial infections in your feet. 4. Because of the thickness it can cause pain in closed shoes, it feels like rocks growing out of the tops of your toes. 5. Increases the chances of developing painful ingrown nails. 6. The sheer distortion of the nails tends to irritate the healthy skin on the adjacent toes, causing abrasions that can become infected. Lastly, it is particularly dangerous in people who suffer from diabetes or circulatory problems. So what are some of the nail fungus treatments? There is no shortage of nail fungus cures on the internet, products sold in drugstores and in general dissemination of incorrect information. Treatment can be difficult because of the fact that nail fungus thrives in dark moist environments and happens to grow underneath the nail. Wearing closed shoes and socks all day with feet that perspire creates a perfect breeding ground for nail fungus. Eliminating those factors can go a long way to reducing recurrence. Nail fungus medications include both oral and topical treatments. As far as oral medications go, for years the gold standard for treating onychomycosis in an otherwise healthy individual has been oral therapy. The most widely prescribed medication today is Lamisil tablets, although there are certainly other antifungals that can be used. The newer generation of oral antifungals are reasonably safe medications if properly used. Lamisil has an adverse response rate of less than 3%. Typically the dosing for Lamisil is 1 tablet per day for 3 months for fungus nails. Prior to taking the medication, blood work is required to check for liver function and renal function. Halfway through the 3-month treatment for Lamisil at approximately 6 weeks, a second blood test is required to see if there's any changes in the liver enzymes or renal function. If there is, the medication has to be stopped. There is also a different type of dosing schedule for Lamisil known as pulse dosing, which has become popular. Instead of 90 days worth of Lamisil, the post-dosing is as follows: 1 pill a day for 7 days, then no medication for the next 3 weeks, then 1 pill per day for a week, and no medication for 3 weeks, then 1 pill per day for 7 days. As you can see, you end up taking 21 pills instead of 90 pills. And the end results can be very similar. Prior to starting on oral medication, your doctor will need to take a sampling of the nail and have it tested to confirm if it is true nail fungus. Visual inspection alone is not enough. Many times a thickened nail is nothing more than keratinization of the underlying nail bed, which is a thickening of the skin underneath, usually from repeated trauma. Additionally, appearances of possible nail fungus can be a result of mold or spore infestation and have nothing to do with actual nail fungus. In those cases, oral Lamisil would be worthless. The other medication option for nail fungus is topical medication. Although readily available, they tend to be less effective. The main problem is that fungus grows underneath the nail, so applying medication to the top of the nail becomes an effort and futility in many cases. People trying to force the medication underneath the nail find that does not improve the outcome at all. The best way to use topical medication is to see a foot specialist who will grind down and cut away as much of the diseased nail as possible, which is generally a painless procedure, so that the topical medication will penetrate to the live fungus more readily. This does become a tedious process as the medication generally has to be applied twice a day by the patient and the nail has to be ground down on a regular basis. The other problem is that depending on the degree of fungus, this process can take upwards of a year. The other problem with most commercially available topical antifungal medications is that they are either of a water or alcohol base, and neither ingredient penetrates nail, which is primarily protein and fat. Oil-based topical antifungals are much better at penetrating the nail to get to the actual fungus. If you do not want to take oral medication or are not sure you even have true nail fungus, then the topical medication is a very safe alternative. Keep in mind, there can be failure using either topical or oral medication. A precursor to those thick yellow nails we have been discussing is a situation where you notice white specks on your nails. Many women will notice them when they remove nail polish. This is what is known as superficial nail fungus, where the fungus is growing on top of the nail and without proper treatment, may burrow through the nail and cause thickening and discoloration. People with this condition should treat their fungus immediately as it is fairly easy to remedy, using a combination of sanding the top of the nail and then applying topical antifungal medication. The last available option for nail fungus is laser treatment. Laser became popular in the United States in the early 2000s. Unlike either topical or oral medication, laser destroys all the different organisms that are growing underneath the nail. Lasers are a painless procedure, but it is not covered by any insurance. Laser surgery has a much higher success rate than the oral or topical medications and is a safe form of treatment. It's important to know with laser surgery or any other treatment that you undertake, the diseased nail itself does not change in appearance initially. What happens is the diseased nail goes from live fungus to dead fungus, but the appearance does not change. Over time, as the nail grows forward, and the nail is cut away, it is eventually replaced from behind with healthy nail, which begins at the growth plate and grows forward. How do we prevent the recurrence of nail fungus? No matter what kind of treatment you end up having done on your nails, that is only half the battle. The other half is preventing recurrence. So once your nails have cleared up, it is important to do some of the following. Use of an antifungal soap such as tea tree oil soap to wash your feet because tea tree oil has antifungal properties. If your feet perspire a lot, you must use a topical drying agent to dry the skin out, otherwise you will have a dark moist environment in which new fungus can thrive. You should avoid using nylons, which promote perspiration. Allowing shoes that are moist inside to dry out before wearing again and spraying them with an antifungal spray. Keep your nails cut short. Space between the end of the nail and the skin underneath is a focal point for new fungal infections. Lastly, women who wear toenail polish on a regular basis are more prone to nail fungus. This is because the polish when applied traps moisture on the nail and thus fungus may begin to grow. Polish should be removed regularly and the nails should be routinely inspected.